benefits of anterior path versus a standard anterior total hip. Number one, femoral exposure is improved. Releases are less because that femoral exposure is improved. Acetabular implantation is reproducible and atraumatic. So I'm doing, again, a better surgery. My aha moment really was when everything came together and I ended up with a great hip with less releases, more stable, and a happier patient when they come back in to see me post-op.
The first real aha moment I had was the very first case I did. I made the stab incision for the cannula. I put the cannula in, and as I was reaming, I realized the reaming was just perfect. There was no soft tissue fighting me. I was getting the exact same location of every single reamer every time, and when the cup went in, it just really felt like it had a solid bite.
All the reaming for a lot of us previously was done using the fluoroscopy or the x-ray. So you put that in there, it kind of blocks your incision, and then you bring in the x-ray. Well, now we have this acetabular exposure that's great in the main incision, and we have a percutaneous way of reaming. I can see almost the whole acetabular rim. I can see the whole entire reamer basket, and I'm reaming under direct visualization. It makes it so much easier, less x-ray time.
We're using less fluoro because of the cannula and because of our visualization through this better placed incision. We definitely are decreasing the femoral exposure and the time that we have to use the fluoro, which makes our OR more efficient. The beauty of the anterior path is that it makes this surgery better, but it does so without the surgeon having to give up anything that they think is important to them in their surgery. So I just can't think of something that you would have to really change in the way you do your direct anterior by adding this in that wouldn't be an improvement. And in time, I think you will find you can make smaller, less invasive incisions. You can change the way you do the surgery from the incision position. You might split the muscle a little bit less, but all those things are positives. There is yet that I can see a negative side to why somebody would not want to try this.
And to top it off, the implants are phenomenal. I mean, if you want to really go full circle, what is the downside? There is none.